So this is a first live podcast for who I consider a hero, Dr. Susan Monarez. Hero, I say, because she stood up for the integrity of science at a time when we don't see much of that anymore because of a culture of fear and all sorts of other reasons. And so this is going back to Dr. Monarez's background. We're going to go through some of the events that she went through in her tenure at CDC, however brief that it was. It wasn't at any time short of happenings. And then we're going to head into the future now that she's a free agent. So, uh, Susan, welcome.
Thank you so much. This is truly an honor. I mean, I think I followed you for so long, and you've been such an inspiration to me. And your Ground Truth Substack is required reading. I know I read it. I hope everyone does. It's absolutely such a delight to be on with you. And yes, this is the first time that I've had a live conversation to a large group. And primarily I waited because I wanted to have a conversation with someone like you who really understands the technical depth and the breadth and the complexity of everything that we do in science. And so it's truly a pleasure to be on with you.
Well, thanks. And I want to announce too that you just started a Substack. Uh, it's called, tell me again, your Substack?
It's called The Road Best Traveled, and
Yeah.
it is a passion piece, and it's a place where I hope that people can amplify those individuals, the ideas, the inspiration in sort of in the health space. Really inspired by the sort of the journey that I've taken, facing headwinds and really having to make some critical decisions about how do you choose the best path when you are in a place where, of course, there's many different ways that one can go forward. And I found a lot of inspiration from people like you and others that when I was going through everything, I just you know um, found a place of optimism and found a place to be inspired. And I want to put a forum forward where people who are similarly, who have been through different challenges and what inspired them and how do they keep moving and some of the biggest challenges that we have in health and what are we who are the change makers that are helping overcome them and what do we do? So it's really just it's going to be a passion place for me.
Well, and I want to give the prelude that you exude optimism, and you had to be to do what you've done, I have to say. And as I think has become clear, that's an important quality for healthy aging. And
Yeah.
so it's great that you have that view. Now, I thought we'd start off with background, that you grew up in rural Wisconsin on a dairy farm, which your father had to sell to, then he became a policeman. Is that kind of the skinny on it?
That's the skinny. I mean, I don't know that I saw it as a privilege at the time, but yeah, when I was a child, my father was idealistic, and he wanted to become a dairy farmer and an organic dairy farmer back in the '70s before that was really a thing, and there was no economic path for him. Once,
Mm.
especially, at some point, his dairy cows, because he tried to keep everything as natural as possible. They got quite sick, and he had to sell off. And we faced some really challenging financial times. And he became a police officer to make ends meet. And my mom was a librarian and worked in other factory jobs or whatnot. But what that does is it grounds you in a way where you learn to appreciate things besides material expectations. And like I said, at the time, it was difficult, but now it grounds me. It keeps me humble in a place where I don't need to have materialism or financial gain. What I need to have is a positive contribution to others, and that
Yeah.
is my core principle. And so,
Well,
yeah,
you
that
do that. And so there you were in Wisconsin, then you went to the top institution at UW Madison. You then got your baccalaureate and PhD degree there, and you're, full-fledged microbiologist, immunologist. You went to Stanford for postdocs. I mean, you had some incredible training, and then you decided you're going to be doing work in the government, various government agencies. I didn't even know the depth of all these agencies that you've been working at. What, for 18 years or so?
is, yeah.
So maybe you can tell us a little bit about that run because you've been with BARDA, Homeland Security, ARPA, H. I mean, wow. Yeah.
It has been such a privilege to serve, the American people at all of those institutions. So I was at Stanford, and I was working on something that was, it was down the NIH pay line. It was deemed too interesting but too innovative, because there was no one else working in phosphoproteomics or differential diagnostics at the time. So I had this idea that if you could look at the differential phosphorylation patterns between, four categories of pathogens: bacteria, virus, fungus, and parasitic pathogens, you could actually have the right intervention, which helps in low and middle income countries when you're trying to make sure, do you give them an antibiotic or do something else. And I had seen the path. I'd seen all of this happen in the scientific, sort of at the lab bench, but there was no way to take that, basic evidence and get it into, an R01 or anything like that. So I sort of had to make this is probably the biggest first uh, path choice that I had to take is, do I change essentially my approach to science in immunology and this, sort of moonshot approach that I was trying to go down, or do I do something different entirely? And the AAAS, the American Association for the Advancement of Science Fellowship, sort of came to my attention, and it was such a unique opportunity to be part of a group of scientists that join the federal government, and they bring that technical depth and complexity, and then they go and help to support policy and science and in the federal government. And I was very, very fortunate to be placed in BARDA when BARDA was just standing up. So the
Mm,
Biomedical
mm.
Development Authority, just it was a brand new agency. I think there were 7 people on the floor. I mean, it was tiny at the time, and I had the opportunity to apply really deep technical science to the portfolio. We had just been given $5.6 billion through the Project BioShield Act, and to be able to make a determination of how do you actually allocate those resources to have the greatest impact to prevent disease and illness from whether it was intentional use of CBRN or whether it was emerging infectious diseases. And so that was such an amazing experience. And so I worked there for a while, and then, I went to another ARPA. I went to the Homeland Security Advanced Research Projects Agency. And that's really where I started to get deeply involved in anticipatory data analytics, AI, ML. And that was back in 2009. And at
Yeah.
that time, you were working in that space, you had to use supercomputers because it was so complex to do that level of data integration and sort of algorithm development and computer modeling and everything like that. But I had the mantra at the time: model anything, anywhere, at any time. And so we were modeling, public health response to different disease outbreaks, and we had global research labs all over the world looking at various biological pathogens and the potential impact. And so I did that for about 3-4 years, and then I went up to the White House National Security Council during the Ebola outbreak in West
Mm.
Africa, and it was such a unique experience trying to figure out how to both address an evolving crisis in a number of countries that did not have public health infrastructure commensurate with the need. So how do you actually get the resources to them in the timely manner, especially when misinformation was very prevalent at that time, and distrust in the support that we were trying to bring, and that actually led to an extension of that outbreak. I was working on the domestic side as well, which is, if we should have some individuals come back who were exposed, what do we do about it? And then of course we did. We had a
Oh,
number of
yeah.
come into the country, and so and that really also shaped a lot of my thinking in terms of not just pandemic preparedness and response, but interestingly, wearables and telehealth, knowing that remote patient monitoring and access to clinical care capacity when people are cut off from brick and mortar institutions, because we saw a lot of that happening with just some of the fear that was when individuals were coming back, and they were either exposed to Ebola, or we thought that they may be, and just sort of the fear factor promulgating, and also the need to monitor individuals who had potentially been exposed. And wearables were just at the earliest stages, but having that level of exposure that early to something of that magnitude really helped shape my innovative thinking. So I was at the White House, was at Ministerial Council, then Office of Science and Technology Policy, and then was the Deputy Assistant Secretary for Strategy and Data Analytics for DHS, which was also, fantastically interesting, running a $70 billion strategic portfolio and looking at data analytics systems for, 23 different individual law enforcement components and trying to have integration across all of them. And I mean, that was also, absolutely fascinating. And then I went back to my roots in health, and I was at the Health Resources and Services Administration, which is a $15 billion organization providing healthcare services to rural individuals living in rural environments or
Mm.
otherwise vulnerable populations. And I stood up a center for innovation there first, because what I saw is that there was an opportunity to bring much greater science and technology and data innovation to the populations that had been untouched yet with this level of innovation. And so that was my first real opportunity to try to innovate in sort of a historic and um, working in under-resourced, and rural populations and trying to advance health innovation was probably one of the greatest challenges that I had because it's there's just such a tension between
Sure.
traditional, how do you provide care and actually innovating
That,
that.
that's saying a lot considering the challenges he had subsequently. Um,
Well,
this
there's all
kind, yeah,
that of
uh,
course
this
was
kind of culminated though. Then you were made deputy director of ARPA H in 2023, right?
Yeah, yep. That was absolutely wonderful. Renee Wegerson was the director, and we had the duty to stand up. The ARPA, the DARPA version of
Yeah, yeah. This
and it was
hub
fantastic.
for the country. That's what it was conceived as, with initially $6 billion support or something like that. And anyway, so here you are. You're at ARPA H. You're providing this important directing function, and then you get the call to be the acting director of the CDC for 2 months, I guess, January to March, and that's of course in the middle of what, 5 outbreaks?
Yep, there were 5 ongoing outbreaks. Yeah, we had Ebola in Marburg in Africa. We had TB in Kansas. We had H5N1 where we really didn't know what the arc was going to look like, and then we had the emerging measles outbreak that was starting in Texas. And yeah, it was. I mean, it was everything that CDC, is expected to be able to handle. And I jumped right in, and a really incredible team, amazing team down there. It's such professionals. I would ask, daily, hourly, what are we doing here? What are we doing here? What are we doing here? And what I would hear under Dr. Monarez, we have this. This is what we do. This is what we
Yeah,
do. How do you
man,
keep
that's amazing.
things? And
Well,
it was just, steady at the helm and decision making based on the evidence that we were seeing in the field. And so it was hectic and frenetic, but it was disciplined. And I really can't say enough about the staff that were leading all of those outbreaks and all of them to a place of resolution.
Oh, so that takes us to towards the end of March after 2 months as acting director of CDC. And then you were, of course, in suspension about being made the real director. And this was the first time in history that this required Senate confirmation. So you are the first Senate confirmed CDC director. Now, this finally led to at the end of July, um, you became the CDC director. And of course, this led to, with our background, within a week or so, maybe 8 or 9 days, there was a shooting at the CDC, which, as far as I know, might be the first shooting in the CDC in history. Hundreds of rounds of shots were taken. That must have been quite a thing to work through, right?
Oh my God, it was gut wrenching and traumatic. I mean, it was day 5 on the job. I mean, it
Okay.
was. I
Wow.
I was sworn in on Thursday, did the background paperwork, and I got down there on Monday morning. And Thursday morning, I my goal for that week had just been meet everyone. So go to both campuses in Atlanta, meet as many staff from all the centers from every part of the organization. I must have met 1,000 or more different staff. I was in the hallways and in the cafeterias, and I walked around and, just lines and lines of people that I had the opportunity to meet, and I would ask them, "Who are you? Where do you work?" And then I would ask them the 2 most interesting questions that I always wanna know, which is, what inspires you, and
Mm,
how do you motivate? And every single person that I talked to, every person, they, uh, they would offer these really inspirational stories about why they were there. They had a calling to do global health, or they had a loved one who had preventable illness, or they wanted to make a contribution for communicable disease control, and all of them were. This is one of the most inspired organizations. Every single person wants to contribute. But what I also found so interesting is they all saw opportunities for innovation, which is what I love. They would all say, if we could do things differently, if we could do this, if we had better data, if we had different tools, if we had,
mm,
this different approach or that different approach, we could do things faster. We could do things less expensive, so we could put, resources in other places. We could make greater contributions geographically or demographically. And those first 4 days were so amazing, and I
mm,
was so elated, and even that morning on August 8th, I met with all the new EIS officers, and this is a group of, I don't know, maybe, 200 young people who, they joined the CDC and the EIS group is Epidemiological Intelligence, Service group, and they deploy all over the world, across the country and around the world, and these folks are so smart and so talented, they could work anywhere, and they
mm,
choose to come work at CDC because they wanna make this extraordinary contribution, and, so I spent the morning, with that group, and then, later that afternoon, I left for the airport. My kids are still up in DC, and I was gonna come up and see them for the weekend, and, it was just the greatest. It was I left with such a warm and enthusiastic, just feeling, and when I was flying into DC, the Wi-Fi wasn't working for quite some time, and then it finally came on, and it was the worst. I started seeing texts of my staff, and the first notifications coming in, something's happening here, and
mm,
we don't know what it is, and then some were sending me these bullet holes in the windows, and I was like, so we know somebody's been shot, and it was just, even now, I get goosebumps just thinking about the feeling of extraordinary helplessness as I'm 10,000 feet trying to, 30,000, and, I finally get into the airport terminal, and I'm calling my senior staff, and I'm, trying to set up our first our first conference call at, something like 6 o'clock at night, and I can't take it in the airport, so I finally get down to the airport basement, and, so it was just the heartache from the senior leaders knowing, it had been almost 200 bullets. We didn't know the total count at the time. We didn't even know, if everyone was okay. And we got all the senior leaders on that call. And I remember just sitting in the basement parking ramp at National Airport, just trying to figure out what happened. Where is everyone? And at that point, I think the federal marshals were just starting to come in to clear the buildings. Everyone was on lockdown or being put to shelter in place, or go to the conference rooms, and trying to get a hold of everyone. Yeah, that was just, God, that was so hard. And then, to find out that the police officer, Officer Rose, had been killed, and there was just the daycare center was right there, and there were so many CDC employees who were trying to get to their kids. Some of whom were trapped under gunfire and being pulled to safety into the security officer offices up there, and it was, and so what went from this extraordinary feeling of like we're going to do some of the most amazing work in our
Yeah.
life, to just knowing that, almost 200 rounds were shattered across the flagship campus of the CDC. In my building, my office suite was just riddled in bullet holes. I tried to get down there. I thought about, should I just get on a plane and get right back down there? But with law enforcement security, I didn't get down there for another, 36 hours. I was down there on Sunday night, and then walking the buildings the next Monday, and I was on the we had conference calls with the staff almost immediately the next morning. We were talking to them all night. I finally stopped talking to people at around midnight, and then got up around 3 or 4 o'clock to try to figure out what's happening in law enforcement, and then calls and video conferences, and then back down there when I walked through the buildings that following Monday and just saw the bullet holes all over the bullets in the floor and the ceiling and the shattered glass, and just it was it was it was such a just I can't even describe what that was like. And you
Yeah.
know the staff were traumatized. I mean,
Oh, sure.
they were in their offices as the bullets were hitting the windows, or trapped in their cars trying to get to their kids. And so I had, 3 things that I had to get done. The first is, figure out law enforcement and security, what was happening there. The second is, continuity of operations. CDC was in the middle of making, all of these different operational activities, and how do we get people, to be able to continue the mission, which they all reinforced. This is mission first, but then also dealing with, the individuals who, although they were clearly wanting to make sure we got to a good place. They were so traumatized and so devastated with what had happened that it was all, that was a huge part of, the next 2 weeks of just talking to staff and trying to understand, what do we do and where do we go from there. It was just,
Yeah.
just an
Sign
experience.
things that this happened. I mean, it's so sick, so imaginable that the CDC that's trying to keep people alive and healthy, and then they're under assault by a madman. Uh, so this is hard to believe that this occurred. Now, that was on the 8th of August.
Yeah.
We had a call on the 19th. It was our first time that we had a chance to talk about anything. And it was a call that actually got me pretty excited because you transmitted your vision, even having gone through this shooting, right? Even with the challenges you were facing, that you wanted to really take the CDC to a different place. You said, you have all this experience with AI and data science, and you have this experience that everyone needs to know that it's not just CDC, it's CDCP, and you wanted to really emphasize prevention and not just for infectious diseases, but preventing, the critical diseases. And we talked about that exciting potential about how we could do such big things on the age-related diseases as cardiovascular, cancer, neurodegenerative, and you really got me excited about your vision for the CDC. And you said, I said, "I'm happy, to help in any way I can as an advisor." But I said, "What? There's only one concern, is that your, higher up, who you report to at HHS may not be too enthusiastic about my participation." But any rate, it was a call, as I remember it, to be invigorating, exciting. And that's when you transmitted what I thought, especially considering what you just been through, um, a transformative vision for CDCP. How do you remember our discussion?
Yeah, I mean, again, this goes back to my tremendous respect for what you have always been doing. I mean, you've been, you're such a deeply technical scientist, but you're an innovator and an entrepreneur and somebody who is just, always thinking about how do we do things better. And I wanted to surround myself. So it's called the Advisory Committee to the Director, which is another federal advisory committee that is constituted to help give the CDC director external thoughts and advice across so many different domains. And I wanted to have inspirational leaders like yourself helping me shape the future of public health. And, I think you and I had connected, or maybe I had just been, yeah, I think that was the first time that you and I talked, but I had been tracking your work directly or indirectly on, biomarkers and how do you actually take what's happening in biomarker development and not just use it strictly in the longevity space, but how could you actually democratize access to the same sets of biomarker panels and technologies to be able to much more broadly allow individuals to understand their wellness, whether it was through the public health labs at the states or whether it was, broader accessibility in clinics and in hospitals. But really, what can we do to scale some of this really exciting work that's happening in a broader public health type domain? And so I definitely wanted you to be part of those conversations, and I wanted to have others that were really thinking that, gosh, we have such an amazing opportunity to be innovative for really breakthrough technology integration into this storied organization. And yeah, I had just been through a lot. I had been through so much in just that short period of time. But again, I'll just say that the staff that I was working with at the CDC, they were also hoping, that this wasn't going to be the defining moment for the CDC over the coming, days, months, years. They recognized that what happened on August 8th was terrible. But where do we go from here? And I was already getting so much positive support to like, okay, we're going to have to fix things. Restoring public trust was the top priority, but then modernizing public health infrastructure, which is what this whole opportunity to innovate. I mean, that was going to be another core pillar of where we went. And yeah, I mean, just me now. I am optimistic and ambitious, and I still
Yeah. Well,
keep do
that
amazing things. But that
that's
yeah, that,
harder to take the position knowing, the kind of adversarial environment you could be dealing with. And then even during that call, Susan, you mentioned, things are kind of rough here. I don't know how long I'm going to be here. We were talking as if, things would smooth out and that you would get, this kind of space you needed to do what you want to do, which was laudable. I mean, more than laudable, hyper innovative. And we even talked about Michael Lewis's book about how he wrote a book about, the CDC is basically, they write reports and observation. They don't do anything really. And how you were motivated to take CDC to another uh, place that had never been before. Now, of course, what happened after that, that was the 19th. The 27th of everything blew up. And we don't need to get into, there's two different versions of the blow up. I think everyone watching this podcast knows which is the true version of that. So we don't have to go back to say what one person said or the other what you said. The point is that you stood up for science and it's unquestionable, and it's something that will be remembered, especially at a dark time that we're in the United States for life science, for healthcare, medicine. You were one of the singular the few people that said, you know what, I'm willing to put it all on the line here because I'm not going to be forced to do something, even in a culture of fear that, oh, well, if you don't do this, we're going to take you down. We're seeing that across many domains of this country right now. So we won't have to get into that because it's something that is probably PTSD related and who knows. But I did want you to comment. The CDC has been gutted. There's been 4,300 people that have lost their jobs. Something like a third of the CDC's personnel are no longer at CDC. And so this has all happened, not just the trauma that you've been through, but what happened to the CDC itself. So it went from this brilliant future to being gutted of its people, no less, shot upon, literally hundreds of shots. What are your thoughts having, been inspired by these people that are dedicated, that would do anything to help American health and of course global health to the point where a third of them have been neutroned out of the CDC?
Yeah, I mean, it I think you said it right. These people are incredibly dedicated. I mean, dedicated, smart individuals. And, I don't even know the breadth and the depth of what's happening on the personnel changes. I know the very small number of people that I've worked with, that, have left. And, you've seen some of them publicly, the three senior leaders that left, shortly after I left, Deb, Dan, and Dimitri. Um, I have to imagine that the other individuals are as similarly, dedicated and incredibly smart as these 3 individuals. And it's, that's going to be a cascading loss for some period of time. I mean,
Yeah,
again, I don't know all the specifics about what's happened on the personnel side, but I know those 3 individuals, and they don't come any smarter. I mean, they
right.
don't are more dedicated. And just, those Deb, Dan, and Dimitri, I could call them almost 24 hours a day, and probably 24 hours a day if I had to. And any question that I had, anything that I needed, they were right there ready to be able to say, well, this is how this works, how that works, especially in the early days when I was really getting up and running. Um, I'm fortunate that I, have the opportunity to still engage with the 3 of them, and, they continue to inspire me. And I imagine that
Mhm.
the other individuals who have now had to leave, are, just dedicated public health, public servants who want to continue to contribute. And my hope is that they can do so in some way, because I know, even in those meetings that I was having first week, where I was just, walking in the halls and in the cafeterias, and, and even some of our research labs, I know how caring, people are that were at CDC. I know how much they wanna contribute. I know that that is their life's mission. And, um, yeah, I hope that all of them have an opportunity to find a place where they can continue to live out that selfless service that I know they're so dedicated to. And
I mean, this is, you're a person that could really understand this with all these years of government service and all these different agencies. What does the word dedication mean? Well, if there isn't an example like this, I don't know of one. So, what a horrible situation to add on to the what happened, just days earlier throughout this month of people being let go, the budget being slashed, and here, the opportunities that lie ahead, no less the worry that, these ongoing outbreaks and the threat even of not just SARS-CoV-2 having a major another variant that is like an Omicron, or who knows whatever else that could happen on the infectious disease side, no less, of course, on the other side. Now, you've learned a lot of lessons. Before we go into the future, which I think is we're gonna get back to exciting again, but how would you summarize this experience, this totally bizarre, just, irrational, you couldn't ever make this up, that you would be given this position with the highest praise of the president, of the HHS secretary, and then, weeks later, after finally getting the Senate confirmation, you're watching this decimation of such an important public health agency. And, you went into it optimistically that somehow you could, with all your managerial experience and all this everything else, that somehow you could, get this on the right plane. What have you learned from all that?
um, hmm, uh, you know that sometimes you just you can't you set a goal for yourself. And in my case, my goal, as you and I had talked about, was to transform this storied agency into the world's most innovative public health, um, service, for domestic and global health. And And sometimes there are factors that are just so much bigger and beyond your control. You can have the best vision in the world, and you just can't get there. And I think, managerially and organizationally has been really, instructive. It's really been an instructive time for me on that end. Obviously, I'll never forget that experience. But on a personal level, it has been a journey of resilience.
Mm, mm,
And, um, and how optimistic and excited I get about, just I mean, pretty much you tell me that we can do something creative and inspirational and help people, and you get me excited.
yeah.
And to go from
Never lose that, Susan, please.
well, I almost did. I mean, I'll be just super frank with you. Um, it did test my personal resilience. Um, Because I had such incredible hopes for the tremendous service that we could achieve through this work, and I just had this I felt this transformational energy that we were gonna have. Then having that, gone in such a short period of time that it really, it took me a bit to try to figure out I'm not done. I'm not. I have too much that I want. Public service for me, and I guess it's this going back to how I was raised, it's a calling for me. I wanna be 97, and I wanna look back on my life, and I wanna and if I follow your directions, maybe I'll be 107 or 127. Gold, okay? Um, but I wanna look back on my life, and I wanna be able to say I helped as many of my fellow humans as absolutely possible, because really there's no other metric for what it means to be human, to be good is how what is the most that you can do to contribute to the positiveness of, life and well-being and your fellow humans and whatnot. And so, I so I dug myself off the couch after a few days, and I started thinking, look, I have to use this as an opportunity, as sort of my own personal call to action for what more can I do? How can I keep contributing? And I have, again, I've had this extraordinary privilege of serving in these various different capacities for 18 years in every different way. And it's been hard and challenging and, different dimensions of the health ecosystem. I've seen every part of it. And I've faced some of the most challenging times, the most challenging, issues that we have. And I want to take all of that and figure out a way that I can harness that, science and health and technology, innovation and policy, and do something really helpful, really big and bold, and so it was it taught me about when things don't work out, and it also taught me to be resilient and to keep having that north star and to continue to push it. And I don't want to. My Substack is going to be all people like that who have just really, had an opportunity to say to face the headwinds and really wanted to continue to contribute to be resilient and make big
Well,
contributions. I also want to do that in other.
well, if there is a model of resilience, you've shown that, and here you are smiling and exuding that same optimism, that you had going into this post, after all that you've been through. Now, one of the other things, of course, that is notable is that in your positions, you've had infectious enthusiasm among your colleagues. You inspire people, just like you were recounting in your first days of visiting the campuses in Atlanta. So we lost not only 4,300 people from the CDC, but we lost an incredible leader who would have clearly inspired those people, even the ones that were remaining, if they had to sustain these cuts, to take the CDC to a place it's never been before. So I lament that loss. I know all of us do because, there would be hard to find someone that could have provided that type of optimism and leadership, which is what you need, especially when an institution like this, a world leader, is under siege. Now, you are a free agent. I don't know that you work for the government again, but you told me a little bit about what's next. So maybe you could tell all the people listening and watching what you've been thinking about.
Yeah. I mean, it's it's sort of this. We had this mantra at ARPA-H with this sort of what if and what is the future that we want to shape, and then what are the biggest and the boldest ways that we could achieve that. And I have had now time to really think through all of the challenges that I've observed in the health ecosystem, and then harness all of the knowledge that I've accumulated over my 18 years in all these different roles. And what I've come up with is this really bold and, maybe a little crazy sort of goal that I think if we have intentionality, we can forever transform how healthcare is delivered in the US. And it's this, I call it this 90-90-20-35. And really what it is it's taking the moment, meeting the moment of where we are in healthcare challenges. Healthcare is in crisis in this country, and it costs so much more to get so much less value out of the healthcare system.
Mhm.
And the 90 is to get 90% of preventive care into the homes of 90% of Americans by 2035. And when you think about that, when you think about the cost of Medicaid, when you think about, the ACA tax benefits going away and the costs of the marketplace plan going up, when you think about private insurance costs are now double the rate of increases, doubling the rate of the salary increases, the cost of healthcare is breaking the backs of hardworking Americans every single day. And a lot of that has to do with the inaccessibility of the front door, which is getting good preventive primary care to make sure that someone knows their wellness and is able to achieve wellness for as long a period of time, whether they are healthy and they want to remain healthy, whether they have a chronic disease and they want to manage it in a more constructive way, or whether they're part of the, nearing 80 million 65 and older population that want to age well in their own homes and they need help doing that. I mean, the cost of aging related facility care is twice the rate of an average retiree's salary. I mean, these things are
Mm.
just so far out of reach for everyone. If you can actually extend preventive care into the home, you bring down overall healthcare costs significantly, whether it's in Medicaid and the states now paying more than 30% of their budgets towards Medicaid, or whether it's, achieving better cost savings through the ACA marketplace, or whether it's in the private insurance plans, or if you're an older adult. And we're now in a place because of the maturation of the technology innovation that I've invested in as someone in the federal innovation space. So much is happening in the private sector. We can meet the moment with these technology stacks in an entirely different way. You could actually develop sort of an AI home health aid that can not only understand you and your longitudinal health, but create the choreography from other preventive type devices that can be easily stacked and delivered to the home, so that you can achieve that level of 90% of your preventive care in your home. Imagine if you didn't have to wait 6 weeks to make a primary care appointment, in which you got 7 minutes with your primary care provider, which is to no fault of their own. There are, we're going to be deficient over 80,000 primary care providers by 2030. I mean, there just is not sufficient supply in the health workforce to be able to meet the demands. If you don't walk into that primary care appointment with the set of 6 questions that you want to have answered because you somehow need to know your wellness status, you can't walk out of there knowing that you have touched the base of everything that you're potentially worried about, or if you're not worried about it, you should be worried about it. So the whole brick and mortar situation is one of this Byzantine process where you have to physically go somewhere. Somebody has to sit with you for 7 to 15 minutes. come up with, most often they'll say, well, just get some blood tests, and then you have to come back to get the blood test. Then you have to come back to have the reading of the blood test. Then you have to come back for your referral. And I mean, and you take a time off of work. You take time, your child has, if you can have 90% of that done in your home before you even set foot in a brick and mortar environment, and that technology exists. I promise you, Eric,
I
it
was
exists.
gonna I was
Not
gonna come in on that, Susan, because you're absolutely right. Not only does the technology exist, but we have the ability to predict these diseases, not just what disease, but also when in people. And we have all sorts of ways to prevent primary prevention of the big three: cardiovascular, neurodegenerative, and the common cancers like we've never had before. And certainly by 2035, like you said, 1990, 2035, your plan, we should be doing that. But my question, Susan, is we're so poorly set up in this country. In other countries where everyone has health care, it's a human right, and they are looking after their population 100%, not even 90%. And they want to invest in things that will prevent these diseases from in the first place. Can the US with its fragmented, fractured, pay for service insurance company stuff, can we ever achieve this lofty goal you're setting?
Yes. Yes, we can.
Okay.
And
See, there's optimism again.
no, we just have to have an intentionality associated
Yeah,
with. And look, is it gonna be incredibly hard because of all the things you just talked about? Absolutely. But I actually think that there is a for-profit business model related to that first 90% of in-home services that if you can take, what we're now seeing as this maturation of technology, and you can create these tech stacks where the cost of goods for that full tech stack is now $300 or so for that unit, and then you actually create a sort of a sustaining interaction through a subscription model or something like that. You actually can create a value proposition that I think you can get a private sector, participation in an entirely different way. But you also create this incredible value to the patients themselves and
right.
to the and even to the providers, as we see that our health workforce shortages are just going to continue to be extended. I actually think now, is it gonna be easy? No.
Oh,
Is it to take incredible leadership and inspiration? Yes. What I'm hoping is that there are other people who are out there who are just saying, like, "We can do something
well,
different."
I'm with you. I want to help any way I can. I think the idea of preventing diseases in the first place, no less, as you outlined, secondary prevention, there's obviously a huge economic benefit, no less the burden of health that is alleviated. So I want you to be successful. It's a daunting and talk about bold challenge, but that's what I love about you is that you're not afraid to go, to the moon. That's what it should be like. Now, would you do this? Would you, if let's say somebody in the government in the future called up and said, Dr. Monarez, we'd like you to lead this initiative to work in the government. After what you've been through, would you work in the government again?
Um, well, I'm gonna answer this in 2 ways. The first is I think we have the ability is to actually start this model in a very significant way at the state level. I really do. I think, I've had the opportunity just in the past few weeks to meet with the state level representatives, and they are so close to their constituents, and they have to meet the people where they live right now in their own states, and the states have the policy levers to at least get something like this off the ground in a pretty bold and ambitious way, and so I actually think that even outside of the federal government, this could, because it
Mm,
is a bridge between nonprofit policy shaping health workforce development, coupled with a for-profit type technology development capability. I actually think a lot of this can be done now within the states and with a public-private partnership in an entirely novel, different way. And so I would say, I would like to push this as far as we can go, without ever touching on the federal government, knowing that, we have the space and the capacity right now. In terms of the federal government, I'm enjoying I'm enjoying life on the outside. I really I am. I feel, I loved my time in government. I absolutely loved it, and I felt so privileged with the service that I was able to contribute during the time when I was there, and I'm looking to serve in a different way now, and I think,
Yeah.
this is, I think this is where I am, and, yeah, I'm still very excited. I still just gonna be the optimist. You will continue to have to take calls from me where I have these ideas and
Well, anytime I help, I think your vision for this big preventive push is the right one. It's the right time. We couldn't have done it before, but we can now. Where we can deal with multimodal AI with all the stack of data for each person, and we can predict with accuracy we've never had before. It builds on the whole notion that these are truly preventable diseases. We can extend health span, and it's that we got to go after. So the boldness, I'm in sync with you. It's doable. We have to just, as you say, have the intentionality. Now, just in wrapping up, I just say you are a hero to me, and I know to so many people have written, in the messages how you're standing up inspired them and will be remembered always. No matter what you wind up doing, you have a long career ahead of you. You're a young woman. So, you know, we're with you. We are totally with you. We know the right version of the story that was told, and we are fully cognizant of what could have happened had you been there and you'd had the carte blanche to fulfill your ideas and your vision. So it's reassuring to know that this hasn't held you back. This isn't going to your resiliency. The capital R is intact, and we need that. I think all of us need that because you have already demonstrated great leadership before you came to in so many different governmental agencies, no less ARPA-H, no less for the 2 months when you were the acting director of CDC in troubled times of 5 major outbreaks. So we're going to need you and your resilience and your optimism and your great vision going forward. So thanks for joining me today. You can count on with any kind of support. I know we have several hundred people that have joined. I know you can count on all their support too. And many more people will be listening or watching this in the days ahead. So Susan and Dr. Monarez, we're great admirers of you. You, during this conversation, you told us why. You told us, really that we learned about you. Many people didn't know the backstory of how you got to this this moment in time that will be probably unparalleled with respect to its lunacy, insaneness. But thanks for what you've done, and also for laying out, where you're headed next. So, any closing comments before we finish?
just my appreciation for hosting me today. Like I said, I just hadn't wanted to have, a broader conversation. When you and I talked, you cemented my inspiration for all that you do. And I'm just, so honored that you took the time to be able to have this conversation. And, um, I look forward to my Saturday morning Substack ground truth reading. And I
Well, we're going to be reading your Substack too, and we're going to be following for
I
this
know.
stage of your career because you're just getting, in many ways, you're just getting started. And maybe this whole ordeal that you went through will just be a catalyst for even greater things going forward.
Thank
So
you. Thank you. I
it's
appreciate that.
great to talk with you. Great to be with you today.
Thank you. Right.
I know. And everybody will have this on the web soon. You can send in your comments. We'd love to hear from you. We're really appreciative for Dr. Monarez taking her time to do this live discussion. And if you have any other questions, we can send them over her way. Go ahead and join her Substack because it's going to be great. You'll find about the road best traveled for many different people and for her. And we'll keep a close eye on her next project of many more projects to come. Bye-bye now. Okay, we're done. And